Is life better after a double mastectomy with greater peace of mind? What kind of scars do women have after this operation? Are they only physical and related to surgery? Let's take a peek into what has been reported in science to help us answer this question. More than 2 million women globally are diagnosed with breast cancer each year. There has been extensive research into the surgical treatment of breast cancer, and still more is underway. This vast amount of information is published in medical journals for our reference and our patients' benefit. Current available evidence from published articles reporting study findings form the basis of therapeutic recommendations. In this video, we will focus on the outcome of a motivated patient and her life after treatment with double mastectomy. The article we will be reviewing together in this video was written by Dr. Fancellu from the Unit of General Surgery 2 at the University of Sassari in Italy. He wanted other surgeons to be aware of the pros and cons of performing bilateral mastectomy. Bilateral mastectomy is the medical term for double mastectomy, and the terms may be used interchangeably. Dr. Fancellu documented the journey of his patient who asserted her autonomy to make her own decision for her treatment. Let's follow her story in this article. His patient was 52 years old and had breast cancer diagnosed through screening. Mammography and ultrasonography demonstrated an 8 mm mass in the lower outer quadrant of her left breast. A core biopsy showed an infiltrating or invasive ductal carcinoma grade 2. The tumor was non-palpable on physical examination, meaning it was too small to be felt. There were no masses in the contralateral or opposite breast, nor was there any lymph node enlargement noted. Based on this information, her condition would be categorized as stage 1 invasive breast cancer. The difference between grade and stage of breast cancer will be covered in another video. For now, we will continue on this patient's breast cancer treatment journey. For those who are familiar with breast imaging, it is evident that the volume of the cancer is small compared with the total volume of her breast. The treating team at the University Surgical Unit took a complete history, but the salient points to note are that she did not have any family history of breast or ovarian cancer. For the surgical treatment of her breast cancer, the patient requested that she undergo a bilateral mastectomy. Having had a surgical consult with the patient and assessing her medical records, breast conservation surgery plus sentinel node biopsy followed by radiation therapy was recommended for the patient. This combination is referred to also as breast conservation treatment and was advised on the basis that in the considered opinion of the team surgeon, the patient had a very low probability of subsequently developing recurrent cancer. The patient asserted her right to autonomy to choose her treatment option and maintained that she considered bilateral or double mastectomy with immediate reconstruction to be her preferred option. In response to her appeal, her team doctors had further discussions and then reiterated their recommendations for breast conservation treatment. Clearly, there was conflict as her treatment team did not consider bilateral mastectomy to be viable as an option. Since this impasse could not be resolved between the patient and her treatment team at this university surgical unit, sought a second opinion from another surgeon at a different institution and underwent a bilateral mastectomy with immediate implant reconstruction. Pathological examination revealed no additional cancer in either breast apart from the index cancer. There was no disease spread to the lymph node. Subsequently, the patient returned to the surgery unit at the University of Sassari for further care and treatment. She was initially satisfied with the cosmetic results of the bilateral reconstruction. At 6 months following the surgery, the patient complained of bilateral breast pain and an almost complete loss of sensation in her nipples. 1 year after her surgery, she mentioned a general sense of discomfort linked to the surgical operation and complained of difficulties with her sexual life. The patient expressed an opinion that she had begun to doubt the necessity of having undergone a bilateral mastectomy and considered that breast conservation treatment may have been the preferable treatment option. The scars that she had are not merely physical. She hinted that she had scars with respect to her quality of life too. Dr. Fancellu and his team are of the opinion that a bilateral or double mastectomy was an unnecessary and excessive intervention for this case. The experience of Dr. Fancellu's team and his patient is consistent with what is published by other international experts. For example, in this systematic review by Dr. Carbine and her colleagues about risk-reducing mastectomy or double mastectomy, the researchers were of the opinion that there are a number of women who may be overtreated with double mastectomy. BRRM is short for bilateral risk-reducing mastectomy, which is a procedure for women who have not been diagnosed with breast cancer, while CRRM is the abbreviated form of contralateral risk-reducing mastectomy, which is often double mastectomy performed for women with unilateral or one-sided breast cancer. These researchers felt that it is critical that women and clinicians understand the true risk for each individual woman before considering surgery. Images of surgical scars after mastectomy and reconstruction will be provided and discussed in other videos for the benefit of women who might be considering this option. These risks are discussed in our other videos we have on the subject of double mastectomy. You may wish to view them to get a better understanding of the relative risks of the various treatment options. Please note that the information and opinions shared in all these videos are purely for educational purposes. Do see your doctor to discuss your specific clinical circumstances and for treatment planning. In this video, we have concentrated on the patient case study presented by Dr. Fancellu. We trust that the other videos relating to this subject would provide more details on the science of surgical decision-making. If you would like to have more information, please comment below, submit a request at the Just Medicine website through the link given in the description, and subscribe to our channel so that you can be notified when new videos are uploaded. Let's chat again soon.